My name is Martin Fielder, and I am an OBGYN at CHRISTUS Trinity Clinic. I was born in California. However, I moved to Oklahoma when I was a young child. I grew up there, went to high school there in a little town called Shawnee, Oklahoma, which is about 45 minutes outside of Oklahoma City. From there, I went to college at the University of Oklahoma, and I went to medical school in the University of Oklahoma in Oklahoma City. I can't say that there's one person that's really made I can target as the biggest influence. I did have a chief resident when I was an intern. His name was Chuck Mirable, who really fostered for me the care for the patient. And so it's not necessarily all the time how much you know or how well you can do on a test, but where he really excelled and that really kind of piqued my interest was how well he cared for each individual patient. And I've always tried to remember that. It's funny, I have a little essay I wrote when I was in second grade, third grade, something like that. And you write down what you want to be, and fireman, policeman, all that kind of stuff. And I wrote down I wanted to be a doctor. It's one of those things I never changed from. And so all my life, that's just what I was going to do. That's what I was going to do. As I learned more about the field, I thought, well, yeah, this is perfect. So I never really thought about anything else. What I love about OBGYN is that I get to see patients in the office. I get to see them in the hospital. I do clinic work, I do surgeries. It's kind of a nice broad range of experience. And then the real cherry on top is delivering babies, because that's a very special moment. I'm there for what is really the most important time in people's lives, or at least one of the top 5. And it's a privilege and it's an honor, and it really differentiates my field than any other. My philosophy in patient care is to provide the absolute best care that I can deliver. One of my statements that I like to tell my patients is that I'm going to give them world-class care right in their backyard. So my goal is to commit everything that I have to them, whether it to be my medical knowledge, my counseling skills, or just a shoulder to cry on. It's my goal to give them everything that I can to help out them in their healthcare journey. I was in the Navy for 5 years. I practiced OBGYN for there, but in the Navy you also you wear many hats, and so I had some administrative roles as well. One of my favorite times was I was assigned to the USNS Comfort, which is a hospital ship. And the hospital ship, there's 2 of them, one on the East Coast, one on the West Coast. And for a while there, we would take tours and we'd be out in the ocean practicing and preparing for drills, which was very interesting. I enjoyed that a lot. The other unusual fact that sometimes people are surprised to know about me is that I used to box. Whenever growing up, I was Oklahoma State champion a few years, and so I don't think I come across much as a boxer these days, but so I think that most people would be surprised by that.